mayam bukurumjari adom yengbiriba si impact news ni ngasi asi malem sinba thungna World Hepatitis Day haina palan taunari ngasi July 19 asigi World Hepatitis Day asiga mari leinana ngasi ekhogi impact news ta health special da pujarakli ba topic asina Hepatitis A and E hairiba hiramasidani loinana ngasi ekhogi studio da lengsinduna lebiriba expert asina Dr. Ganesh CP MD DM consultant hepatologist ILDS Hospital ni Dr. Bu ahan ba makta taram nokchari Dr. ngasi akhogi malem sinbetuna World Hepatitis Day na su palan taunari ado World Hepatitis Day se kari gi damakta pangthokpano aduduga handak chahi gi oina magi message sina habi theme sina kari oibagi habdu khangsa
World Hepatitis Day hoibado hepatitis B and C oibaleina leiba migido liver failure end stage liver disease aduga liver cancer lakiba chances ti yam leibanina World Health Organization ko organization amalei mana sigi end point ama tammani 2020 to 30 pau magi end stage ama tammaga magi lotion ba pame adudi lotion ba pame haibado by the end of 2030 there should be less than 5% of the patients who are being detected with hepatitis B and hepatitis C adumana thamjari adugi tobagi maram dadina we need three main steps amana prevention amana detection amana treatment adigi oibanina this year we kept a theme of let's break it down adu leiba myths and taboo gumbadi breakdown tobagi sumaina theme ama thammire so maru oibada early prevention by vaccination early detection by proper testing and early treatment by giving adequate medication oigadaba
everything ngallinge da hana early stage ta khangdo hoba
khangdopa aduga early detection and early treatment ogadaba by doing this we can prevent and stop it by 2030 haigadaba
30 sine
target World Health Organization na tambi ba target na 2030 ne
aduga doctor koige huziki topic shiga mari laina na makata na lecture bada koige hepatitis A haibasina karino haibeto khangza hoge
loinamak migidi hepatitis B and hepatitis C gi matangi kharadi awareness legini because this is blood and sexually transmitted disease ne and sumaina laye hebadi end stage liver disease aduga liver cancer lakiba chances su leipana aduna hepatitis B and hepatitis C among awareness the karadi legani but hepatitis E ga hepatitis A ga uji karadi incidence and prevalence kara wang banina adu matangda just awareness gumba pining ba so hepatitis A aibado it's an viral infection sidi yam contagious ne contagious aibado si kamai lake aibado hangbado it is transmitted by feco oral transmission aibado pattaba ishing gumba pattaba chaba time dadi adum pull up chaba for example there is a pond in our village adu di pond dadi si virus mix thoren kallo so people who are using this pond will get infected so mana infection lakpi baya aduga boarding amalere boarding the angang shing di adum pullaga leibanina if the virus is becoming contaminated in that area so minus spread to be aduna feco oral route haibane ishing pattaba ishing gumba pattaba changumba chaba time dadi lakki daba sina infection hepatitis A ga hepatitis E ga irakani so this infection is an acute infection see am chronic viable chances the leite but sina it can cause 10% of patient the yam satiba acute liver failure gumba lakiba chances kara leipane
aduga doctor hunna so hujik pan pibda haibedi mayam ko pullaga kholaga de haibedi an jackson inga obenina ma si se kai degi haibedi anambana sandora pa yawi magi causes se si di kari no oibegi habdu
kari hoiba aduna hina haiba it's an RNA virus ne ko hepatitis virus ne this virus will affect your liver adum affect obi be so si virus di kamaina contaminate tore hangbado si virus di for example aina haibado pond amalere everybody is using this pond for their daily usage haibado adumana infect tore haibadi loinamakidi it gets spread and for example patient amadi small hepatitis A infection the affect tore haibadi see am chronic oiba chances laite 90% of the patient used to get cured by themselves at the end of 2 to 3 weeks but 10% of the patient gidi see sati baraga acute liver failure gumbal akiba chances karalai adu we need to be aware about it aduga sumaina contamination gumba leiba jagada de for example me amagi lakren kallo for example one patient in a locality is getting hepatitis A virus aibado and people among that area should be aware because in a feco oral route of transmission leibanina like patients who are in close contact sina blood and sexual contact dinattene this is because of the feco oral route of transmission aduna sumaina like I amada me amagi sumaina infect tore hebadi other people should be very careful, they should be very sanitized aibodo pasanna kut hamaga chagadaba adumaina tawgadabana it can prevent the transmission adumaina prevent to bbi
adu doctor na su hoje pan bi khibada masa mathanta amu phaja khibagi ama su pan bi khiba masa mathanta phaja khibase sisina kamai tawbono to su khatang khangjaba
adumaina tawbado. For example, patient amagi lion kallo. The patient, one of the patient has got the hepatitis A infection. Adu maina laya hebadi magi lagpa symptoms kara legini. Adu di we can identify. Adu identify toba nammani. Kari lakani initially patient ama infect toba matung the hepatitis A infection lion kallase. Adu maina toba matung the patient the initial fatigueness legini. Isa soktarani. Adu matung the abdominal pain legini. Fever kara ABBI. Adu matung the patient gidi mitti yellow kaba jaundice gumba lakpagi chance lai si karam kanda lakani hange ibadi for example patient amana infection lavre within 2 to 6 weeks manung the lak pbi so maina lakpa symptoms to
I have the mit hangapan kaba yellow kaba to gumba okay se masa sokthaba gumba se lakto ne magi signs
fever lakpa puk naba aduga oningba gumba lakpado signs and symptoms hoirakani
adu doctor magi treatment sidi kamaina tawgani aduga magi tokhaiba tongan treatment kati leibra
treatment gudi chapchaba sumaina hidak pigedaba gumbadi leite ko but this is like a self limiting disease aina haiba 90% of the patients is in a self limiting ne adu mana just supportive treatment gumba kara IV fluids gumba adu gumba darkai obi 10% of patients the sina kara sati be obi aduna acute liver failure kowe acute liver failure haibado kaino doctor hange haibado patient gi kian mang ba stage gumba email lang ba gumba lak pbi but it is only seen in 10% of the patient adu maina patient amana hepatitis A nare ma adum yumda lere treatment lawre but khara gyan mange mana khara taranchale adu maina khalle ibodo it's considered as very emergency situation adu maina lakning the begine sumaina awareness program ama tamme adu maina laye hebadi patient should be initially admitted under the care of a proper specialist aduga mana pasna layen to kadaba kaigino hebado sumaina acute liver failure stage layen kallase adu maina laye hebado mortality do she bagi chances is near around 30 to 40% ne and patient might end up requiring liver transplant also
adu dugo doctor magi hojiki hepatitis A se mioi amadagi amada launa ba yaba chances yam wang lebanina hoina prevention hoina precaution hoina kari tawba yabage habito
prevention hoina uji kidi World Health Organization aduga Indian nation organizations they don't advise guidelines tadi leite vaccine ama kapiro hebodo hepatitis vaccine gumbadi leibadi lei but we reserve that vaccines for very high risk patients hebodo liver cirrhosis nabami already liver cirrhosis leibami liver transplant aduga kidney transplant tawra matungda immunosuppression koba hidak chabami aduga for example me amada like I amada lakren kallase for example outbreak hoire like I amada outbreak hoire sumaina virus outbreak hoire hebadi in the locality we can advise patients and advise the people in the locality to take vaccines sumaina vaccines kamai kapani hebado it's an usual vaccine program 2 times kap kadaba there should be an interval of 6 to 12 months between the 2 doses sumaina vaccine kape hebado there will be lifelong immunity for hepatitis A virus or else patient amana lavre for example hepatitis A ama lakanta magi improvement lakre he has settled adu mane laiba migisu lifelong immunity lakani so I will advise karamba patients na hepatitis A vaccine lawninge haibado so patients who are having liver cirrhosis already liver cirrhosis leibami aduga liver transplant tawraga immunosuppression lobami aduga kidney transplant tawraga immunosuppression tabami aduga immunity kara suppress hoibami plus even children who are in boarding schools adumaina pullaga leibami gido prevention is better than cure hypanina hepatitis vaccine lobanina it's very good for them aduga hepatitis A vaccine lawra matungda side effects kara lakadra hange hebado no there is no side effects until now documented aduga immunity lifelong 95% to 98% leiblinina it is very safe so early boarding the labor students and sumaina liver cirrhosis aduga liver transplant tawraga immunosuppression chabami aduga kidney transplant tawraga immunosuppression the labor gido hepatitis A vaccine hapado yam safe hoire
habadi moidadi henna
high risk hoibanina so we can prevent adudi kaigino haibado even that 10% of chance we should not take 10% patient gi acute liver failure lakpai be yabado adu su prevent to begin in a vaccination program do but until now now there is no vaccination program. World Health Organization aduga Indian immunization programs tasu hepatitis C di laite, but one can get it done by himself by approaching various institutes or hospitals.
Aduga doctor akoina vaccine se kapthok sage hai taragadi chahi gumba laitadra natraga magi age bar laibra adugumba
age bar gidi we age bar di laite even ujik paudi pediatric age group people su lawre aduga maximum 65 pau data lay data hibado research tawraga publish toba data lay adu maina side effects kumbadi laite and immunity stays lifelong high reko aduna even pediatric age group and even adult age group we can prescribe this vaccine given if they are falling in high risk group. High risk group hibado people who are very common to get this infection ayugadaba adune mainly high risk group haibada aina
habide dum angang dagina dum chahi 65
pau 65 pau PBI data lay raisigi angang oibado mainly angang kana boarding the leba angang do pullaga leba angang do adu gumbadi khape haibadi it will give you more prevention and more protection
habide mayam go
punbagina
yam nungai je doctor dagi makha dana khangzani gi ba habide khoi hepatitis E gi matang da so mulak sege adu break on khatang lokjaki matang swai sida break on khatang lokjage break tagi yamna thuna hanjurake impact healing miding ta thuna lebiu.
Big announcement. Akas Manipur chapter gi tuition fee handak chahi gi oina 100% wife tawjiragani. Akupa marol gi damak makhada pijariba telephone number asidagi khangwi bayagani. Natraga aikoi gi campus office ta legbiraklaga akupa marol khangwi bayagani. Loinana experience leraba faculties singna class tawbusu hokre.
Mayam bu amuka hana taramna okchari ngasi asi World Hepatitis Day ni loinana hepatitis day asiga mari lainana ngasi health special da pujarakliba topic asina hepatitis A and E hariba hiramasidani loinana ngasi ekhogi studio da lengsin duna lebiriba expert asina Dr. Ganesh CP MD DM consultant hepatologist ILDS Hospital ni Dr. bu amuka hana taramna okchari Dr. na huzi break ki mamang da so hepatitis A ki matang da maroi ba wafam kaya ma thambi khare makhata nam khangjani ngi khoi hepatitis E sina kari no haibado khangjage aduga ma hepatitis E siga A siga kari khena ba lai bege
hepatitis E virus haibado chumme adu virus ne adu liver the infection tokiba virus ne same like hepatitis C sisu yam contagious ne spread oi by I virus ne so India dadi yam common cause for acute viral hepatitis hange badi hepatitis E is the most common cause toba virus to hepatitis E ne hepatitis E ga difference kai no doctor hange hebado animak to chamana RNA virus ne animak to sumaina acute viral hepatitis symptoms produce toguni an hebado fatigueness nausea body pain gumba vomiting gumba puknaba gumba fever aduga jaundice toguni sina difference hange hebado this is the most common cause for the leading cause for the viral hepatitis plus sina kharadi satiba compared to viral hepatitis A. Kaigino doctor hange badi this affects predominantly pregnant women in their last trimester. Magi last 2 to 3 months the labor migidi yam affect tauba virus ne. And once affect tawre haibado pregnant oiba time dadi magi mortality she bagi chance to 20 to 25% increase tawni. Aduna this is very much required in pregnant females idi si am sati bane sumaina symptoms pregnant oiba time dadi sumaina symptoms laya hebadi we need to get it tested as early as possible aduna sumaina kamaina detect toguni hebado aina haiba symptoms karadi legini patients da plus blood the IgM antibodies hepatitis E ga IgM antibodies test togodaba yam important ne
adugo doctor hozik doctor na so haibe pambi ki beda khogi pregnant lady khogi miron bi dana haibe di mana tha ani ahum sidadi yamna sigi hepatitis E se lakpa ya be chances mana wang haibe ko adu akhoi Manipur da di sigi hepatitis E sigi thengna birabra adu duga akhoina mapan da chatlu bagumba lai taraga di haibe di hepatitis E se usilapa ya be chances wang bra
adumaina haibado hepatitis E gi prevalence hange haibado India dadi kharadi it's around less than 1% ne yam kannadi laite Manipur dadi adum tengmadi tengeye sidadi lakpadi the patients are coming to our institutes with hepatitis E virus even during their pregnancy time but prevalence is the yam name it is less than 1% mapanda chatpa jaga dadi lobby by yagadra hange badi kharadi high risk area kharadi leiko for example northeast di it's little bit high risk for hepatitis E plus Ladakh gumba high hilly areas dadi kharadi risk karadi wange plus sumaina aina haiba hepatitis A matam da so haiba time dadi when we are having some disruption adumaina haiba do contaminated ponds gumba contaminated ishing gumba laiba jaga dadi adum pullaga laiba time dadi lakpi bayai sigi kene hepatitis A gi hepatitis E gi kene kaino haiba do hepatitis E will affect more in the pregnant females and magi mortality di mana increase tawani adu katangne the difference major difference between hepatitis A and hepatitis C treatment di hange haibati we don't have special drugs or special treatment for hepatitis E magi so same conservative supportive treatment ne for example we give hydration magi hydration pigini fever lak patain di kara hidak pigini aduga adumaina maintain tagodaba only ma han hepatitis A dadi acute liver failure lakpagi chances to 10% ne magido acute liver failure lakanta mortality lakpagi chances to 20 to 25% especially in the pregnant female patients aduga magi last 3 months na ya maruai bane last 3 months of pregnancy last trimester hibado last 7 8 9 months tadi kara sati bagi lakpi beyai so minor symptoms lae jaundice lae patients ki fever lae pain abdomen vomiting nausea so minor lae badi one should always think about this acute viral hepatitis and get tested and properly adequately treated to prevent unwanted complications
aduga doctor akoina hojiki hepatitis E se lakle hairaga de akoida sign and symptoms magi kamaina ulakadage aduga hepatitis E se lakra matamda hojiki pregnant lady da budi hena sathiba ma oy and risks oy na haibigre ko ado atopa da su ma se kayam yamna sathiba oy bage habidu khangse
atopa mayam da sathiba hoigra hange abdi chamanene hepatitis A gi general population di risk of getting acute liver failure aduga acute liver failure haibado e mai langba unconsciousness lakpa adugi chances is same between A and E in general population but in hepatitis E in pregnant females see kara sati bane because of the pregnant related changes etc see kara sati bane aduga treatment di aina haibadu chammanane so the in general population manimakidi risk is same and treatment is same females in pregnant age group and pregnant patients in the last trimester magi kara contagiousness and the effect of the virus is very high and the mortality is also around 20 to 25%. General population the acute liver failure lakpagi chances to is 10% in both the viruses. The mortality ki chances sange hai badu general population the suppose acute liver failure lion kalla se hepatitis A naraga natra hepatitis E naraga lakpagi chances to 10% ne suppose lie acute liver failure lie hai person lying to hai badu magi mortality chances is less than 1% if adequate care is given.
aduga doctor akhoi doctor na su happy pan bi kre ko treatment gi se magi treatment se karamba mawong da chathaba yabagi specific magi tongan da treatment dai ra
adune aina haipa there is no specific drugs sina hidakidi for example hepatitis B ga hepatitis C ga specific drugs karalai ko for example hepatitis B nare hebadi tenofovir ko drug amalai hepatitis C nare hebadi velpatasavir sofosbuvir ko drugs le sina exactly to kill the virus hai but hepatitis A ga hepatitis C ga exactly adumaina pibagi drug di laite to be conservatively managed for example layo karalaye running nose karalaye hebdi conservatively manage to the manage to but patient might need monitoring haibado until magi bilirubin level normal lakpa time dedi regular checkups gumba adumaina pasana care da gumba laye hebdi even minute maina for example acute liver failure natrada e-mai lang bagi symptoms lion kalase we can find it very early and treat it adequately with supportive measures adu maina tawbanina it will go down and resolve completely aina I want to press on this point hepatitis A and hepatitis E adum yam chronic viral chronic will never occur in hepatitis A and hepatitis E yes hepatitis E virus tadi kharadi document tawre which is very minimal 0.01% the chronic OIB by I but hepatitis A tadi adumana di amtalaite there is no chronicity haibado chronic hoiraga liver cirrhosis gumba liver cancer gumba laki by agadra hange haibadi hepatitis A tadi it's 0% chance hepatitis E tadi lakpi by chances lay but it is very less 0.01 high BBI percentage
yam name
compared to hepatitis B and hepatitis C hepatitis B ga hepatitis C ga sumaina chronicity lakpado it's very high chances hepatitis A and hepatitis C da adumaina lararoi be yam name da
adu dugo doctor ngasai hepatitis A ki da pan bi ki beda ma de adum mathanta amu recover taw ki ba habidi phaza ki bagi ama pan bi ko adu hepatitis E da di ma se adum mathanta adum phaba ngambra
chammanane 90% they cure by themselves only 10% might land up in acute liver failure adu treatment treatment modality, recovery modality, animakti cham. Only na haigedabado hepatitis E pregnant patient dadi kara cautious legedaba, they should be properly and properly treated to prevent unwanted complications.
Aduga doctor ngasai di doctor na panbira matam da su huziki hepatitis E si di haibidi pregnant lady akhoi miron bi nupi dadi yamna khara sathi ba oibe yae na su panbire ko adu ma khoina sidagi hepatitis E sidagi ngakthokna leina bagi damakta akhoi di prevention oina precaution oina kari tawba yabagi
sumaina ujik kidi recently China or India dadi study tawraga hepatitis E gi 20 matungdadi vaccine ama tohe vaccine ama lakpane recombinant vaccine haire. So this vaccine is giving good prevention from hepatitis E. So hepatitis E gi vaccine ujikatang laye just 4 to 5 years in the market lebrina magi research kumba ujikso challe, but results the yam promising way. For example 4.5 years to 6 years ki prevention gi rate di yam pasaye. For example 95% 98% prevention taw bire. So I also suggest hepatitis E vaccine kana logni available oigadra India available oira hange hebodo. Yes, it is available. Even in Manipur it is available. Hepatitis E gi vaccine do. Hepatitis A vaccine is available everywhere all over India. They available ore Manipur dadi ahanadagi available oire. Hepatitis E vaccine ujik Manipur dadi we have made it available. Aduga si kana logani hange hebado same like high risk patients hebado. So a patient boarding the bangang singidi lakpi baya adu de mana logadaba liver cirrhosis labor patients, liver transplant toraga immunosuppression labi patient aduga. For example if the patient is having kidney transplant immunosuppression chabi patient immunity handaba patient di lobi baya as like hepatitis A da. Aduda sir loinamak hepatitis E na female pregnant patient di sati be lakmina every female pregnant patient should take vaccine hangbado. Aigi point mataktedi lobanina fare because research and data di ujik paudi leite, but this gives you 100% prevention and unwanted complication prevent obanina. Patient who are in high risk area hebado northeast the high risk ne aduga even in some part of the North India and some part of the South India like Kerala da kharadi high risk labanina adu main high risk labor jaga didi lobanina fare lobana it's very good. Plus if the female who is in medical profession to minor laboratory research the research the toba so minor specimens handle toba person oibanina masu lobi bayai. And if the pregnant patient is if the mana pregnant oiba mamang dadi mani immunosuppression gumba chare hana mamang the liver transplant or adu mana tore abadi before planning their pregnancy they can get this vaccine. Adu pregnant oira matung dasu lobi bay agadara hange hebadi yes they can get it.
Adu pregnant oira su lobi yai
it's a recombinant vaccine live attenuated dinate recombinant oibanina lobi bayai.
Adu duga homagi de adum lifelong oigadra adu dikamai
ujikidi data na research toraga data pibado we have a data for 4.5 years to 10 years ki di prevention di laire haire. So we need more data di lakani ujik invent tobarina 2020 dagi 2019 dagi market de laibanina we have data for 4.5 to 10 years how the prevention di personal laire in haire
5-6 years ka tangai binino
5-6 years hepatitis A gi vaccine di hana dagi laibanina magi data jam phase adu lifelong immunity di pigani haire ko. But hepatitis E gi di data di karadi name so we need to wait for more data, but until 4.5 years to 10 years the vaccine di kharadi challe pasane the vaccine prevention di pire sidi kamai logani hange hebado. This is also 3-dose vaccine. Nasi amal lauren kalase aduga 1 month leraga dose amal logadaba aduga 6 month leraga dose amal logadaba adu maina 3 doses ne 3 doses the divide to bire. So ujik idi kana logani hange hebado the patient who are having liver cirrhosis and liver damage and patient who are on immunosuppression aibado liver transplant ga kidney transplant ga lawra matung the immune suppress to bagi hidak chabami plus high risk group the labami. For example doctors like us and like lab technicians minus sample handle toba midi logadaba. So regarding the pregnant patients if they should take, my point of view is that yes they should be given the chance to prevent unwanted acute liver failure which might occur in hepatitis C. Kaigino hebado once laya hebado then treating them and saving them is going to be little bit more serious compared to prevention. So always prevention is better than cure webanina so maina tawbanna fare. But until now there is no organization World Health Organization natraga Indian immunization program makadadi sidi leite. So this is will come up next 5 to 6 years the personal lakh PBI programs the su lakh PBI and it can be given and hepatitis E vaccine India the labro hange hebado yes it is available currently in India even in Manipur it is available
Manipur da sudum phazam hange ado doctor na huzik takpi gebda huzike hepatitis E gi vaccine se dose ahum thokna have 3 dose kap ne have ahan ba dose se kap ba matung first dose gi matung da second dose se 1 month later ne ba aduga third dose na mo 6 months aduga if akhoi gi pregnant lady sina magi first month sida ahan ba se kapaga adu ta di magi second month di
banina kem problem di later roy but for example me amana high risk group the laren kala say for example she is traveling to some high risk area endemic areas karale Africa gumba travel toning ba avoid to namde mana pregnancy plan toren kala say so before even planning pregnancy we can finish this protocol that will be the very very safest pregnant over time the su lobby bi kem problem di lara roy but still mana pregnancy plan toren kala say aduna before starting our pregnancy if she is able to complete this vaccine this will be very very useful kana kanagino hange hebadi sumaina high risk group for example lab technician gumba doctors gumba the travel togadaba for example Africa is very very endemic for hepatitis adu maina travel toning ba me oibado mana before planning the pregnancy they can complete once pregnancy plan tore pregnant oire adu matung the prevention gi di PBI because it's a recombinant vaccine the safety di leibadi lei
aduga doctor akhoi gi huzike vaccine se kap khra matung da mangon da kari kari tholak pa haibedi akhoi gi
sumaina hange aibado yes mild self limiting aibado self limiting fever gumba lak PBI mild myalgia gumba lak PBI that is the sign of immune response adu maina laya hebadi the immunity is building up over the virus IBB sina uji kapiba virus to vaccine the laiba virus to satiba virus tinatte it's a part of the virus to generate immunity in the body adu maina p samapiraga body gi own immunity increase togoni aduga atoppa infection lakninda ba prevent tobi adune vaccine gi concept we don't give entire virus we give a part of a virus adu the body virus ki di foreign body kallaga immunity generate togoni so mana immunity generate togina for example if is traveling to endemic area adadagi lauren kallase adu lakpa time dadi immunity laibnina that virus will be killed by the body adugine vaccine gi primary concept
adana hozik vaccine se lawba su yai aduga hozik Manipur da su vaccine se phazana available
yes
yam nungai je doctor na hozik hepatitis A gi matang da su E gi matang da su kanar ba wafam ke am thambire adubo aroi bo na doctor dagi hepatitis A amadi E gi matang da message am khatam pe
message ama maru oibado ipining mundabado so sanitation is very very important see sina feco oral transmission mode of transmission patta beishing dagi patta ba acha pot gumba chaba gumbadi lobby benina so I ask everybody to maintain proper sanitation proper hand wash gumba tawraga lebanina this can be prevented and it mostly occurs in children's between pediatric age group the labor children's aduga until 30-35 the yam tengne adult the yam kannadi lararoi kaigino hebadi we are all have immunity from the beginning so ujik labor angang idi they are all like pampered kids adum yumdadum they don't get exposure to the outside world oibinina the proper sanitation pullaga labor time the vaccination kapi bina fare plus whenever a patient or person gets infected in a community proper screening of the entire community test orga kangbi bari ai aduna proper screening toren se adu maina tawre hebado it can get controlled and patient kana ki treatment darkai hoigada patient gido personal treatment hebado just conservative support doctor gi follow up makada tam kada adu maina tawre hebadi we can prevent acute liver failure adu maina prevent tawre kallase do mortality di yamanda bibi since it is an acute virus we can do much and prevent it once so maina prevention gi awareness laye for example patient is getting infected nausea vomiting adu maina laye they should understand that they should go and consult an doctor regarding this hepatitis A virus so hepatitis A ga hepatitis E ga final message amado sina acute virus ne chronic di oiraro yes hepatitis E da di chronicity karadi lei it's very very minimal so these are acute virus mostly contagious virus ama outbreak ama laye like aida ama outbreak laye hebadi everybody should be maintaining the sanitation proper hand wash kumba proper utensil wash kumba tobanina this will can be the chain can be break down.
Having hepatitis A amadi is in amna sativa kashudi oira kadabanate aduna koina isana sanitize na koi khut cha hamaga kaino masara su kola so having angang sing mayam punba sida adumina sanitize ina labor sine yam maru habs
sativa di natte but it is contagious adu understand togadaba contagious wabinina proper sanitation gumma maintain torebadi we can break the transmission so it's only 10% life risk aduna adu 10% su chance lounding di adugine small awareness program tamaga kara educate towning ba that is the message behind this
havidi sathidra su lowna gan balaina ba oi banina havidi section isa section basine ba khwai tagi maru bas yam nungai jai doctor gi mamal yam la matam khara kai thok pirang ngasi world hepatitis day ga mari lainana hepatitis A and E gi matang da maru ba wafam khara thambi bagi damakta doctor bu hana thangchari ngasi gi damakta di matang swai da special health program asi